What's up, y'all? It's Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer weight management, hormone pellet therapy, intimacy solutions, total wellness with supplements, and laser hair removal for both men and women. And most importantly, we offer gynecology to women and adolescents. Our goal is to help you live well, age well, and experience everlasting intimacy. So happy Monday. I hope it's been a good start to your week. Definitely has been for me. And today we're going to talk a little bit about what a normal cycle is and what's not normal. So basically, what you should expect from a normal cycle is that you're having a cycle anywhere from every 24 to 35 days. And when we count cycles, we count from the first day of bleeding to the next first day of bleeding. Okay. And that's how you count your days. So the average woman is about 28 days, which is why birth control pills are usually for 28 days. But some people are going to be the 24 to 35. That's what we still consider normal. Normal bleeding can last anywhere from 2 to 3 days all the way up to 10 days. Normal bleeding is where you can leave a pad or a tampon on for a few hours without messing up your clothes. If you're messing up your clothes or having to change every hour for several hours or several days, that would be considered heavy. If you're noticing lightheadedness or dizziness when you're having your cycle, that would be considered abnormal, because that means you're bleeding a little too heavy. Also, if you have severe cramps that don't go away with ibuprofen and Tylenol, then your cramps are more severe and that should be worked up as well. So also, if you're bleeding between cycles, so having cycles more frequently, like every 2 weeks rather than every 24 to 35 days, and remember that's counting from the first day of bleeding to the next first day of bleeding. Also, if you're having severe cramps that keep you from doing other things, keep you from going out, keep you from going to work, keep you from wanting to be bothered, that is when it's time to look into your cycles and see if there is something else going on, or if it's something we can do to make your cycles easier. For the heavy bleeding, there are some things that you can do as well with birth control pills. And if you want non-hormonal treatment options, or you don't want to do birth control, we can give you progesterone for the end of your cycle to try to decrease the amount of bleeding. And we have another pill that we can use that you only use during your cycle. Is non-hormonal. And for many women, that decreases the heavy flow. But first, if you are having irregular bleeding or abnormal bleeding or severely heavy bleeding or skipping cycles, not having a cycle every 35 days and going 2 and 3 months without a cycle is still not good. So you need to see the gynecologist for that. But if you are having regular cycles, not too many cramps, and you're doing fine, yay. And the other thing that can happen with cycles is PMS, or premenstrual syndrome, which, or PMDD, which is a severe case. And that's when you may have some changes in your mood. And if they are severe, you need to let us know about that, because there are some things that we can easily do. For some of my patients, they get a mild anxiety medication that helps with irritability, and they just take that during their cycle. For some of my patients, they actually do birth control and do continuous birth control so that they don't have the PMS symptoms. And then so that's mainly the two options for PMS. And sometimes I give progesterone towards the end of the cycle and through that time, which can also help with significant PMS symptoms. So it's normal to have cycles. It's abnormal to bleed more frequently. So if you're having a cycle every 2 weeks, it's super heavy, or you're skipping cycles and going more than 35 days without one, all of those things should be worked up. You can schedule your appointment at Me Bella Wellness Center, 205-995-1009. Remember, hormonal birth control really works great to improve cycles, decrease the amount of bleeding. And for some of them, it can actually suppress bleeding, which is fine as long as you're on hormonal birth control, and that's what's doing it. But you can't just skip a cycle without being on hormones or birth control without letting us know, so we can work that up, because that could be an issue down the road. So it's Dr. Mia with your lovely gynecology tip for today, and I will see you guys on tomorrow. I hope you are having a fantastic start to your week, and go live well, age well, and experience everlasting intimacy. And if those cycles are off, let's do a history and physical at your appointment, get a full workup, which can sometimes include an ultrasound as well as some blood work, and figure out what's going on. So if it is a problem, we can fix it. And if it's just a quality of life issue, we can fix that as well. It's Dr. Mia at Me Bella. I'll see you tomorrow.